Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe. This is a concise, well-crafted summary and it highlights only the important keywords. Oral submucous fibrosis. So oral submucous fibrosis is a premalignant lesion and it is formed of the fibrous glands in the oral cavity. It leads to the restricted mouth opening, as well as the tongue movement. It increases the risk of the squamous cell carcinoma. This is due to the poor hygiene. It is more common seen in the Asian population and it is especially seen more commonly in the females. Now what will be the risk factor here? The risk factor is for the oral submucous fibrosis, and the erica nut use and the betel nut use. So all these nut users, it can be a risk factor. Next is management. Management is by the preferred treatment is by the intralesional injection of steroids. And also, so there will be injection of steroids. Next is there is also the triamcinolone. Then comes what is alternative treatment. The alternative treatment will include the surgical excision with the grafting. So surgical excision plus graft with the grafting. To learn and grow daily like this, please do subscribe.